Hello, this is Taylor with West Physiotherapy, and this is the final video on the series of urinary leaking. Not so much talking leaking as waking up at night to have to go to the bathroom in order to urinate. So this is, it's called nocturia, and if you are not on Medicare and you are waking up more than one time a night because you have to go to the bathroom, then that's really too many times. This is a nuisance, I think, because it's interrupting your sleep. You have to get out of bed. You have to, get back into bed, try to go back to sleep, which can be difficult for people. I don't know about you, but I don't really want to be awake for a long time with my 2 a.m. brain. It's like the most worrisome brain that I have. So I would rather just kind of sleep through that time. But, in addition to being a nuisance, it can also be a sign of some more important kind of health factors. So when you are, when we're sleeping at night, we're cycling through light sleep, deep sleep, light sleep, deep sleep. And as the night goes on further, the stretches of deep sleep in that cycle are getting longer. So more of your deep sleep is happening later in the night. So if you're interrupting that by getting up several times a night to have to go to the bathroom, then you're not getting as much deep sleep. And that's important because deep sleep is when we get cellular repair. And we also get the glymphatic system, which was recently discovered and has been in the news somewhat in the past couple of years. This is when our brain is really healing itself. And it's only happening during deep sleep. So we really want to protect that deep sleep because it's so important for our health. In addition to just feeling good and feeling rested. Okay, so if you're waking up frequently, all right, we're going to talk about several strategies to help with this in a few minutes, and they're really simple. But basically, our body and our brain do not want us to have to wake up to do this. So the body is normally kind of suppressing these functions so that we can get deep sleep. So if that's not happening, and we're not doing something silly like drinking a bunch of Coke before we go to bed, then we have to be asking, why are we not sleeping better? Why are we waking up to have to do this at night? So the waking up at night to urinate, or the nocturia, can be a sign of a sleep problem. We can have a sleep problem because we have a vitamin D deficiency, which is we're finding is more and more of us are vitamin D deficient because we're not outside as much. We can also have a sleep problem because we have something called sleep apnea or some kind of airway obstructive airway disorder. Sleep apnea can be a problem with the brain, but more often it's something called obstructive sleep apnea, which means there's too much pressure or there's not enough space for the airway. There's not enough air getting through at night. All right. I think we tend to associate sleep apnea with like much older people, older men, maybe people with really kind of like a lot of weight around their neck, but it's becoming more and more common in a lot of people. There are a lot of reasons for that, which I'm not going to get into, or hypotheses for why that may be happening. I won't get into now, but suffice it to say it is happening more, and it can have long-term effects on our health. So we have increased risk for heart disease, increased risk for increased blood pressure, increased risk for depression, increased inflammation and chronic pain, and increased risk for some cognitive type diseases like Alzheimer's. So none of that is very good. So what are some symptoms? Let's say you're waking up a lot at night and you have no idea. How would I know if, I might have that problem? So some other signs and symptoms that tend to go along with having an airway disorder or disrupted breathing or sleep apnea at night are, a big one is snoring. So this is like the tube is narrowing and it's making a lot of noise, basically. So snoring, if your partner tells you they've ever heard you do this, okay, like a big gasp, definitely worth looking into. So those are two big indicators that if you're frequently doing that, you may have an obstructive airway problem. But there are some other subtle things. So bags under your eyes. Now that can happen if you're having allergies or sinus congestion. But frequently waking up with those dark circles, it's venous pooling in this area, and that can be an indication that there's not enough space in there for the airways. It's like there's not enough space for the blood to drain, and there's not enough space for the air to get through. Waking up in the morning with a dry mouth or a really sore throat, that it can be an indication that you're not getting enough air through the nose and you're having to open your mouth. So you're waking up with a dry mouth. Just generally feeling like you're waking up not feeling rested. You were in bed, you slept for 8 hours, and you woke up and you still feel really tired. You may have woken up with a headache, or you wake up feeling worse than you felt going to bed. So the waking with sleep apnea is you're not always consciously aware of that. And that's why you feel like, well, I'm getting 8 hours of sleep. I don't understand why I don't feel better, or why I still feel so tired during the day. Some people will even have daytime sleepiness. So if they finally sit down for a minute and stop doing something, they might start to doze off. If they start watching TV, they might start to doze off. So those could all be indicators that something's going on with your sleep, and it's definitely worth investigating. And I would say a lot of, in the clinic, this comes up. This comes up with my women in the clinic more than you would think. And I'll tell you a couple stories. One was an older woman. This was her primary complaint, was waking up at night, having some anxiety at night, having some increased urgency, and having to wake up, every 1 and 2 hours a night. So I was already working up in her neck because of the relationship with the vagus nerve and autonomic nervous system and some of the anxiety that she was having. But I also noticed she had a very narrow roof of the mouth and kind of pinched and pointed through here. And as I started talking to her, she also had some ringing in her ears, or tinnitus. These can be related to cervical neck dysfunction, neck problems, and also jaw issues. So we just started working on her mouth a little bit, actually doing physical therapy intraorally inside her mouth, trying to open up this palate a little bit, give her tongue more space, which when we were done, no problem. I feel like I have more room in my mouth for my tongue. That's awesome, because if you don't have room in your mouth for your tongue, where's it going to go? It's going to go back in your throat, and that's going to contribute to blocking the airway. So this type of treatment went so far with her in solving this nighttime urination problem. She started being able to go longer stretches, 3 and 4 hours, without waking up. She did not have the same level of just sort of unease and anxiety when she went to bed, before she went to bed, and she did not have the same level of urgency. So when she did have to wake up and go to the bathroom, she wasn't having that urgency and fear of leaking or not making it to the bathroom. So that was really exciting. And that was when a lot of these pieces with how connected these things really are started coming together for me. And I'll tell you, another woman was treating for hip pain, and just how was your day? How did she start talking about how she woke up with a headache? I said, wait a minute, you're waking up with headaches? And sure enough, she had big bags under her eyes, and she had some, increased girth around her neck. So I started talking to her more about this and doing a little more investigating and doing some of the things that I used to screen, some surveys and looking at some other things with her. I said, I really think that, this is worth looking into. So she got a sleep study and found out that, yes, indeed, she was not sleeping well at all. She was waking up a lot and having a lot of apneic events. So sometimes, the people that we end up seeing in physical therapy who are having, their hip hurts. Okay, you fix the hip, now the back hurts. Okay, now you fix the back, but they're still waking with headaches. And you're just kind of playing this whack-a-mole all over with just this, something's always hurting, and they just don't look like they feel very good. They seem tired. So when we start paying attention to these, we start sometimes seeing that, there is something deeper. There's a bigger piece of this person's health that's driving a lot of all these other little things that seem like they have nothing to do with each other. So I feel like a lot of times people are really hesitant to look into this because they've seen CPAP machines and they think, I don't want that. They don't want to look like Hannibal Lecter with that thing on. But what I would say is, don't let that discourage you, because that is one solution to the problem. It could be the one that's needed, but there are a lot of improvements that we can make, honestly, with some hands-on manual therapy from educated therapists in the head, neck, mouth region, to help mitigate some of these problems. And also, there are other things that you can do. So dentists can work with your jaw position. Sometimes it can be as simple as just something that you wear in your mouth. For some people, it's as simple as just not ending up on their back at night, and those can be some easier strategies. And for some people, they need the CPAP, but for most of those people, the difference is so amazing. I've talked to patients who they've worn them, and their reflux went away. They're finally waking up, rested. Little aches and pains are going away. So don't let, having seen or heard about a CPAP deter you from kind of investigating if some of these things are starting to sound like, I'm checking off a lot of these things on my list. So I wanted to talk about 3 simple things that you can do to help decrease the amount of waking at night to go to the bathroom. So one is really easy. Just stop drinking fluid 2 hours before you go to bed. That's it. The next one is avoiding alcohol at night. Alcohol, we talked about, this can be an irritant to the bladder. It's also going to limit your deep sleep. So you're not going to you may fall asleep well, but you're going to wake up. You're not going to sleep as well. Your liver's going to be more active. It's also going to keep your heart rate elevated. So I found this out for myself. I was wearing an activity tracker. It tracks my heart rate overnight and my deep sleep. A lot of these movement trackers are actually fairly accurate, tracking your deep sleep, because we get paralyzed in deep sleep. So you really aren't moving very much when you get it. And sure enough, my heart rate, if I have a couple drinks, as high as 10 beats higher overnight, less deep sleep measured, and I just don't feel as well. So, sometimes we know it. We know we don't feel as good. We know we shouldn't be doing it, but there's something about seeing it on a screen, like, oh, my heart rate's usually 65 and it's 75 in the middle of the night when I'm supposed to be totally relaxed and resting. So, that's another thing. And then the other is just during the day, keeping everything running as smoothly and healthily as you can. So drinking water regularly throughout the day, and then regularly going to the bathroom, so that at night, your body is not having to deal with taking care of some of that stuff. So, this is something that I see in the clinic. This is something that I screen for with a lot of my patients. And you just start seeing it. You start sort of seeing certain signs in people's faces, and certain things that they're telling you that kind of make you start digging a little bit deeper. But I wanted to offer right now basically a free virtual screen for this. So if you've been listening and you're starting to hear a few things where you're like, that kind of sounds like me, then this is something that we can do a really simple screen with virtually without even getting in the same room. We can do a simple survey, looking at a few things with your head, neck, posture, range of motion, and also with how your jaw and mouth are moving. And just get a sense of, is this something that you might want to investigate a little bit further? So I'm offering that right now. You can comment screen if you're interested at all in that, and I will reach out to you through the messenger. So I hope you found this helpful, and thanks a lot. Bye.